Do you know that 1 in 10 women of the world's female population is affected by PCOS? My name is Juliet Imo. Welcome to the 9th episode of Walking Through Infertility. Today we'll be talking about polycystic ovary syndrome, also known as PCOS. I just want to create awareness, talk about it. It's like a one-stop shop for everything you probably need to know. An overview, basically, of polycystic ovary syndrome. So take just 1 minute of your time, send this video to anyone you think might need it, and come back. Let's get into it. 1, 2, 3, 4, 5, 6, 7. Okay. Polycystic ovary syndrome. I have my laptop open. I'll be sharing what I know that is available in the public domain. I'm not a doctor. I don't have any I'm not a technical expert in this information I'm about to share, but these are information that are available online that you can still get more information on. But basically what I'm trying to do here is to summarize this information so that if you or anyone you know is currently going through any of this, it might lead you to start thinking in the right direction. So let's get into it. According to WHO, World Health Organization, polycystic ovaries is a reproductive disorder that affects women. It is caused by an imbalance of reproductive hormone, especially the one known as androgen. Androgens are produced in the ovaries and we need them. But when the ovaries begin to produce excess of it, there is usually an imbalance, and this imbalance is what tends towards PCOS. PCOS is considered as a hormonal issue because it involves the hormones in the body, and when these hormones are produced at very high levels, that throws every other thing that is supposed to work hand in hand with out of balance, leading to this polycystic ovaries. Polycystic ovaries causes tiny cysts to be formed in the ovaries, especially when they are not supposed to be there, tiny in the outer part of the ovaries. It is also considered to be a metabolic problem because it leads to metabolic dysfunction that affects several tissues in the body, such as the adipose tissue. That is probably why most people who are diagnosed with PCOS usually tend to be overweight, and it affects the liver, it affects the pancreas, it also affects the skeletal muscles. In addition, the excess androgen produced also causes the ovaries to cause what we call systematic metabolism through the brain, increasing adiposity and reducing insulin insensitivity. Now, when the body is not sensitive to the presence of insulin, what it will do is produce more insulin, and after some time, the body tends to be insulin resistant. Let's talk about statistics, the PCOS statistics. It is said that 1 in every 10 women is affected by PCOS. As we're talking about 8 to 15% of the world's reproductive aged women are affected by PCOS. This is quite a large number. To put it into context, what it means is that if you have 10 women standing in front of you right now, there is a possibility that 1 person out of the 10 has PCOS. That's 10 in 100, 100 in 1,000. So that's quite a lot. That is quite a lot. So there's a possibility that somebody beside you might be having PCOS, and yet the person is not aware that they have PCOS, or that you might even be having PCOS and you're not aware you have PCOS. Because you know why? 17% of this female population are not even aware that they have PCOS. So that's quite a large number. So if you have 10 people out of 100 having PCOS, seven of those people don't even know they have PCOS and might never know, because 50% of women with PCOS go undiagnosed or they are wrongly diagnosed. So that's actually a big problem. Statistics too tells us there is a very high chance of having diabetes if you have PCOS. It says you could have diabetes before your age 40 if you have PCOS or pre-diabetes. It is also a leading cause of infertility. So despite affecting millions of women in the world and the very serious consequences and complications that can arise due to PCOS, PCOS is still unknown to most people, and a staggering 50% of the women living with PCOS are going to go undiagnosed. Sad, isn't it? Now, according to NHS website, if you have two of these symptoms, or if you present with two of these symptoms, there's a likelihood that you are affected by PCOS. The number one and the biggest culprit of them all is irregular periods. So if your periods are irregular or they are absent or they are heavy, then you should check out if you have PCOS. There are some women who don't see their period month in, month out, or maybe 9 out of 12 months in a year, or their cycle is longer than 40 days, 39 days, or sometimes when it comes, the period is heavy for more than 5 days. It's going on to the 9th day. These are cases of very irregular and abnormal periods. You should check with your medical practitioner. The way it presents itself is excess androgen, and excess androgen can be easily dictated with facial hair. When a woman has facial hair on her chest, on her face, there's a likelihood she might have PCOS. The third thing that a woman could present with that could lead to a PCOS diagnosis is when the woman has polycystic ovaries. Polycystic ovaries are small fluid-filled sacs that are found in the ovaries, tiny ones filled all over the ovaries. This is usually found through an ultrasound examination, and if a woman presents with such features, then there's a possibility the person might have PCOS. Now, according to NHS, again, if you present 2 out of these 3, there is a high chance that you will be diagnosed with PCOS. To be sure, blood will be taken to check your hormonal levels, such as your androgen level. Your ovaries will be scanned, and ultrasound will be carried out to check the state of your ovaries, and then of course medical history. So all of this would help to help the medical practitioner to make an informed decision on whether you have polycystic ovary syndrome or not. Now, if perchance you present and it's determined that you have PCOS, then the issue of treatment might now come into play. But prior to talking about the treatment, there are some other symptoms that you can present with if you have PCOS. If a lady has these other symptoms and as well as the either of the three other main features of PCOS, then it could go add to affirm the fact that the person is being affected by PCOS. Example is severe acne. You is determined that you have insulin resistance with unexplained weight gain could also be as a result of PCOS, anxiety and depression, male pattern hair loss. These are also symptoms that you could present to affirm that the person might have PCOS. But funny enough, there are still some people who don't present any symptom. They have regular period, there is no hair loss, there is no excess weight gain. They might not even have polycystic ovaries, as well as the other symptoms we've called up. And yet they might still be having PCOS. There might still be no symptoms, unfortunately. I think that is probably one of the reasons why it's very, very difficult to diagnose PCOS, because every person seems to have a different symptom or none. So there is no like a standard pattern to it. Okay. Somebody might not present any of this until much later when they discover that maybe they are unable to conceive and all that and begin to carry out the investigation. And that's probably when they will discover that they have some of the symptoms that were not presenting itself earlier on. Apart from these symptoms that we've mentioned, there are also some other symptoms, not well-known symptoms, or that could show up in somebody who has PCOS. Example of these symptoms are sleep apnea, insomnia, fatigue, brain fog. These are other symptoms not well known, but they can also present in people who have PCOS or who are affected by PCOS. Complications of PCOS can include infertility, gestational diabetes, pregnancy-induced high blood pressure, miscarriage or premature birth for people who do go on to get pregnant, severe liver inflammation caused by fat buildup in the liver. It can also lead to high blood sugar, unhealthy cholesterol, significantly increase your risk of heart and blood vessel cardiovascular diseases. It could also lead to an increased risk of heart and blood vessel diseases. It sometimes leads to type 2 diabetes or pre-diabetes. It can lead to eating disorders, depression, anxiety. And it could also lead to cancer of the uterine lining, that is also known as endometrial cancer. These are complications of PCOS. According to World Health Organization, PCOS has no cure. According to World Health Organization, PCOS has no cure. However, the symptoms can be managed. And how you manage the symptoms depend on what it's your goal at the time. So you can manage the symptoms before you start thinking about getting pregnant, or you can manage the symptoms because of the goal to achieve pregnancy. Now, if you're managing the symptoms without a target to get pregnant, maybe you're not married, you're not ready to start having children, but you want to manage the symptoms of PCOS, then your focus will be taking care of all the symptoms that are not related to fertility at that time. Your medical practitioner will give you medications that will help regulate your menstrual cycle and hopefully manage your menstrual cycle so that you would at least be having your menses every month. And this will include birth control medications or birth control drugs, could be pills or any other form of birth control. This will help to regulate your menstrual cycle. Some can also help manage, and some of these can also help manage acne and hair loss. Another treatment option will be insulin sensitizing medicine. This would also help you to process insulin, help your body to process insulin so that your body will stop producing excess of insulin because of lack of sensitivity. Your body will now begin to process insulin to know when you really need more or less insulin. And with that, it will help to regulate your menstrual cycle and also help you manage some other symptoms that are prevalent with people affected with PCOS. You can go on to take androgen blockers. Androgen blockers would also help to alleviate the symptoms that are associated with PCOS. One other way, which is usually advised, and usually the very first advice you get given is lifestyle changes. It is known that sometimes if somebody who is affected by PCOS is able to lose 5% body weight, then it will show, and this can be managed by regular exercises, regular but moderate exercises, eating well balanced meals would help you to manage your weight, and in the same way help you to manage the symptoms of PCOS. If your target is to achieve pregnancy, then the treatment options available to you will be options that help you to ovulate. So, ovulation inducing drugs will be used. We'll have the pills, and then we have the injections. Any of them will be used to help trigger ovulation. And once you trigger ovulation, hopefully you will go on to get pregnant and carry to term and have the baby. The other option is the use of insulin sensitizing drugs. One very popular one that has helped people with PCOS a lot is metformin. But I'm not a doctor, so I'm not going to prescribe. But it's out there in the public. Is available for public consumption on Google, anything, and that's why I'm actually bothering to mention the name. Metformin has been used over the years to help the body to process insulin, and then in the process of processing insulin, it will encourage ovulation, it will stimulate ovulation, and then hopefully the woman will go on to achieve pregnancy without any further assistance or reproductive assistance. If all of this fails, if the use of ovulation inducing drug as well as the use of insulin sensitizing medication fails, another option left would be laparoscopic ovulation drilling. In this case, your doctor will go in to your ovaries through your tummy, through a pinhole, and go into the ovary to drill out or take out some part of your ovary, the tissues in your ovary, with a bead to remove some androgen, and then in the process help your body to trigger ovulation. But I also found out that this option is not used as often as it was used in the past. So there is a tendency, or rather the medical practitioners are not using these options the way they used to use it before. If all of this fails and you still haven't achieved pregnancy, the other option left for you is to carry out an IVF, in vitro fertilization, where the body is, the ovaries are induced to produce eggs then the eggs are harvested, and then in a laboratory, the eggs and the sperms come together to fertilize, an embryo is formed, and the baby is transferred back into the mother's womb for to grow and hopefully carry to term. So this is like an overview of PCOS, the complications, the symptoms, the treatment method, and then the focal point will be to change your lifestyle, eat more healthy diet, manage your sugar intake, and then commit to moderate um, physical activity that will help you to manage your body weight. However, if all of this, you've tried all of this, because I've read that the it doesn't, the frustration of not seeing your period, knowing that you're not pregnant yet, you can see your period, or the frustration of having uh, always having acne, or the frustration of having facial hairs, and then being overweight, even though you're trying everything within your power to manage your weight, and yet it's still being difficult. Having hair loss when you're not balding like a man. These are all frustrating and can actually affect your mental health or mental health well-being. As much as all of this, also as a young person, having to deal with brain fog, finding it difficult to remember things. So these are all things that will definitely affect your mental health if you're not careful. But however, I'm here to tell you that worrying about it or allowing it to affect your mental health too is not going to solve the problem. Really, it wouldn't. So I would rather you realize that you can't, the only thing you can do is manage it, seek medical help, eat right, exercise, but don't dwell on it so much that you add more to the pain you're going through by worrying yourself over something you probably cannot do more than what you're currently doing, seeking medical help and taking the medical treatment and doing what you're doing right now. So the good news is that if it's pregnancy, you can still go ahead to achieve pregnancy by seeking treatment early enough and then committing to that treatment. There are things you can also do to manage the symptoms that will give you a better lifestyle or a better outlook to life. And then again, I need to also let us know, every other person who is currently not going through PCOS, be kind. You really don't know what people are going through. You don't know why that person you think your body shaming is overweight. You don't know why that person has facial hairs. You don't know why that person seems to be forgetful at times. You really don't know. So be kind to people because you don't know their story. You don't know their story. So let's all be kind and make the world a better place for our family and friends. Thank you for spending time with me today. If you know there is somebody in your life who has any of these symptoms, then maybe kindly suggest to the person to visit or go with the person to visit a doctor so that this can be treated. Thank you very much. We'll see you again next week. Bye.